So, hello. So do tell us where you're watching us from. It's good to see you. We should have had this conversation yesterday, but like you noticed, we had a bit of a challenge with our technical issues. Something wasn't just working yesterday. We still don't know why, but today here we are. So good to see you. I know we haven't uh, been talking live for a few days now, and I'd like to emphasize that we will, tackle the same topic we should have discussed yesterday. A very short and brief conversation on prostate cancer, so that everybody's brought up to speed on what's happening with regards to prostate cancer and why you should take interest in the subject. Why is it important that you, as a black person or as a black man, you should take an interest in this subject of prostate cancer? So that's the very short and brief conversation we're going to have this afternoon. So because we didn't announce prior, so we will give another minute for people to join. So do go ahead and tag somebody, invite somebody. You can, share this on your streams. You can share this on your page. Whatever you like to share it, please go ahead and share so that we can spread as much of this information as we can. Secondly, please tell us if the sound is good. If you can hear us loud and clear, please go ahead and tell us. Let us know if the sound is very good. Julia Kayasa, you're watching us from Kitwe. Thanks for joining us. And it's good to see that the ladies have taken an interest in this subject because this affects all of us. Brian Owens from Kablonga, Lusaka. You're saying the sound is good. Thank you very much. We needed that assurance. So let's get into the subject. We are discussing prostate cancer. And like we said, it's going to be a very brief talk on prostate cancer. We shouldn't take too much of your time. Many will probably go up to 10 minutes. But here's the issue. Just lend me your ears for these very few minutes. Why must we discuss prostate cancer among men, especially here in Zambia? The reason is that, first of all, prostate cancer is one of the leading causes of hospitalization, especially when you look at cancers. If you take all the cancers and put them together, you'll find that prostate cancer is one of the top cancers. And if you just take men only, you'll find that it's one of the it's at the very top of the cancers that affect men in this country. And that's precisely why we need to discuss it. And the other reason we need to discuss the issue of prostate cancer is that you will find that in its early stages, prostate cancer has no symptoms. So people would be walking around feeling very healthy, like nothing is going on, because they are not going to know that they have it, especially in the early stages. The other reason we are raising this issue is that when prostate cancer is caught early, treatment outcomes are generally very good, especially where your doctors are now able to monitor you and plan treatment for you. Outcomes are much better because your doctors can now plan for how they're going to look after you. So that's one of the reasons, again, we need to do it. Secondly, screening for prostate cancer, or thirdly, rather, screening for prostate cancer has become faster, easier, and cheaper. In the sense that nowadays, when we are screening for prostate cancer, all we do is just take a blood test on your finger. We do a blood test on you, and we're able to tell whether your risk is high, that you now need to go and do further testing or not. That's precisely why we are having this conversation. Okay, so now, prostate cancer in general, when you look at it, you will find that the people who are most affected by prostate cancer is people where you find that you are a black man. So women are not affected by prostate cancer because women don't have a prostate. Maybe before we go deeper into this conversation, let's talk about the prostate itself. The prostate is a gland. It's a very, very small gland. It sits just below your bladder, the bag that keeps urine. I wish I had pictures here to show you. So there's a bag that keeps urine. Once urine is formed, there's a bag at the bottom of your tummy here that sits there. It's a bag that collects the urine. Now, from that bag, the urine is taken out of your body through a tube again. Now, at the bottom where that tube begins, that takes urine out of your body, that's where the gland sits. That's where you find the prostate gland. Now, the prostate gland is only found in men. It is not found in women. So you will never find prostate cancer in a woman. Prostate cancer is always a disease of men. Now, like I have said, because the gland sits right there at the bottom and the tube that carries urine passes right through it, you'll find that when symptoms develop, one of the things you'll notice is that people begin to have problems passing urine. Either they are delayed to pass urine, or there's an obstruction, they can't pass urine at all, or there's blood in urine, and later on they start experiencing backache. That is when the cancer has spread. Now, what we are saying is that you don't need to wait until you have those symptoms for you to get yourself checked for prostate cancer. Because if you wait for the symptoms, it may be too late. So what we are saying now is that if you are in the risk age group, and I'll be discussing the risks very shortly so that you're also aware of, who is at risk, what are the issues. If you're in the risk age group, it's very important for you to check yourself for prostate cancer from time to time. Because should we find that, you need further testing, the testing will be done for you. And should we find that you may have cancer or that you do have cancer and it's in its early stages, then your doctors, who are called urologists, and I'm not one of them, by the way, urologists would then be able to plan for you what the best course of action is going to be. And what we have observed is that early diagnosis improves outcomes. It improves survival. And that's precisely why we are even having this brief conversation with you this afternoon. So, what are the risk factors? Who is likely to develop prostate cancer? The first major, there are other minor risk factors, but I'll focus mainly on the major risk factors. And there are three major ones, but there are other minor ones. But I'll focus mainly on the major risk factors. The three major risk factors for prostate cancer is number one, race. The fact that you are a black man, you are more likely, if you take all the races under the sun, you'll find that black males or black people are more likely to develop prostate cancer than other races. Now, this does not mean that other races that do not develop prostate cancer, they actually do. You will find prostate cancer among Caucasians, among Hispanics, among Indians or Asians, if you like, you will find prostate cancer there. But the frequency of prostate cancer in these races is a lot less compared to black people. That's why you find that even here in Zambia, prostate cancer is one of the leading cancers among men. Even when you go in the hospital to check, you find that it's a leading cancer among men. Now, the second risk factor is family history, especially if there's been prostate cancer on your father's side of the family, not your mother's side, on your father's side of the family. If there's been somebody who's had prostate cancer on your father's side, either your father himself, or your grandfather who gave birth to your father, or your uncle who was born from the same father as your father, your uncle's on your father's side, then the risk is higher for you. The other one is age. You will notice that the frequency of prostate cancer begins to increase, or rather begins to increase quite a lot. Once you cross the age of 55, 65, 69, you're into your 70s, it begins to increase. The frequency begins to increase. So as you advance in age, the risk also increases. All right. So those are the key risk factors for prostate cancer. So very quickly, the key risk factors are race, age, and family history. Those three, don't forget them. So then, who should go for screening? Okay, who should go for screening? Generally speaking, people will tell you that if you are 40 years and above, you can go for screening for prostate cancer. Generally speaking, I have said that myself as well. But again, I need you to fully understand this, that when we are testing for the prostate cancer in the blood, the protein that we look for in the blood needs to be interpreted within the context of the patient who has presented. That is why when you are going for screening for prostate cancer, make sure that when the test is done, you need to sit down with the doctor who will be able to explain to you properly what the results mean. Because not every person who has an increased amount of the protein that we look for has cancer. That you need to be very careful about. Because, for example, if you have an infection in the prostate, like prostatitis, that protein we look for prostate cancer also may go up. Okay. Sometimes even a UTI can cause the same. So your results would have to be interpreted within the context in which you have presented. That's why it's critical that as you go for screening, the results are interpreted by people who understand the disease process. It's important. Interpretation is important of how that blood test is understood. One of the things that one of you asked was, Doctor, me, I'm afraid to go for prostate cancer screening. We know you do it at your clinic, but the fear we have is that you push the finger in our rectum. No one is going to push the finger in your rectum when you go for screening. What we do nowadays is a very simple blood test, so you don't need to be afraid. Do not fear, okay? Because no one is going to push a finger in your rectum for screening. However, there are further tests that may be indicated, which may also include a digital rectal exam, which is pushing the finger in the rectum if your risk is high, or if we have found that the blood test has shown us that your levels are so high that we have to do further testing. So your doctor may order that as well. But for the purposes of just screening, it's just a blood test. Now, who must go for the blood test? First of all, if there's a history of prostate cancer in your family, then you need to start screening earlier than everybody else, meaning that in your 40s, you must start screening. If there's a history of prostate cancer in your family, then for you, you need to start screening in your 40s. Make it a habit, okay? One of the people asked me, so how frequently should I do the screening? Well, if you can do it once every 4 years, it's adequate. If you can do it once every 4 years, it's adequate. Now, there are some who prefer doing it frequently. I've seen some clients who prefer doing it every year. It's also fine. Especially if you're high risk, it's also okay. It's up to you. But once every 4 years is adequate. Now, if there's confirmed history of prostate cancer in your family, you need to start doing screening sooner than everybody. So in your 40s, you must start. If you're in your 40s, start. Now, how many of you know what caused the death of your relatives in your family? Most of us, our grandfathers or our elders in our family, when they die, we don't know the cause of death. Usually we attribute it to witchcraft. So meaning that most of us don't even know our family history in terms of our family history of our diseases and things like that. Why? Because most of our elders, when they fall sick or when they die, it's much easier to attribute their problems to witchcraft. And because of that, most people don't know whether or not there was somebody who had prostate cancer in their family. Most of you don't know. That is why we encourage you to just start the screening in your 40s, because you don't know your family history. But if you do know your family history for sure, then, and you know for a fact that there's no history of prostate cancer in your family, then for you, you can start screening when you're about 55 and above. That's the general recommendation.
You can start screening for prostate cancer when you're around 55 and above, if there's no prostate cancer in your family. You are very sure there's no history of prostate cancer on your father's side of the family, you can start around the age of 55 to screen, going upwards. But if there is history of prostate cancer in your family and you're very sure that there's somebody in your family who had prostate cancer, you need to start screening earlier. In your 40s, start. If you're 40 and above, start. If there's no history of prostate cancer in your family and you're sure there's no history of prostate cancer in your family, you can start screening at 55 and above. And doing it every 4 years or every 3 years is adequate. But I know some who are doing it every year. They are happy doing it every year. Now, why should you screen? The advantages, like I have mentioned, is that should we catch the disease early, your doctors will plan for your care much better, and it will prevent hospitalization. It also prevents you from getting advanced disease. It also allows you early intervention, and outcomes are much better. Now, somebody also asked, Doctor, how then do I prevent prostate cancer? Now, we don't know for sure how to prevent prostate cancer. We don't know. We don't know for a fact or for sure. This is a foolproof method of preventing prostate cancer. We don't know. But there's observations that have been made that people who stop smoking are less likely to develop prostate cancer compared to those who continue smoking. So if you smoke, stop smoking. People who are obese, overweight, okay, tend to develop prostate cancer than those who are less obese. It doesn't mean that those who are not obese will not develop prostate cancer. They might, and they will, or they will, they could. They could, actually, not that they will, they could. But if you compare the obese and the non-obese, prostate cancer is more frequent in people who are obese, so meaning that reducing your weight also can be put on the list as a way of reducing prostate cancer. The other thing is exercise, regular exercise, having a healthy body weight, and also eating well, having a good diet, a healthy diet, a diet that is plant-based is very good for you in terms of trying to prevent prostate cancer. But here's the thing. These things, you do them in combination. All you are doing is you are reducing the likelihood. You are not preventing it altogether. You're just reducing the likelihood. Now, once you do these things, plus screening puts you at an advantage. You don't want to be surprised as a man. You don't want to be surprised. So go out there, get yourself tested, get yourself screened. And ladies, you are very good at encouraging men. Men don't like going to the hospital. Men hate needles. Please encourage the men in your lives to go for prostate cancer screening, or at least to go and sit down with a doctor and discuss their options. They may not necessarily do the test, but let them just go and sit down and discuss options. Make this conversation around prostate cancer easy to have. As we come to the close, let me ask you, ladies and gentlemen, to go ahead and share this video. We need this information out there as widespread as possible. So do go ahead and share this video. All right? Help us spread this news. Just click that share button and let the message go around. That said, it's been a pleasure talking to you, and continue drinking water. Do take care. We'll probably see you tomorrow.